Today we're going to talk about the basic perceptions of social media use in health communication. In order to do that, we first need to talk about what health communication really is. Health communication is something that's very important to a patient's health and well-being. But health communication can be really hard for someone to participate in if they don't understand the information that they're being given. This is why health is sometimes referred to as being a maze. Patients have to navigate the different ways towards better health, and they have to navigate through the pieces of information that are thrown at them by their providers. This is why health communication needs to be adapted and changed so that patients can better understand what their providers are trying to help them with in regards to their health. It's important to realize that social media use is growing. It's no secret that this is occurring. In fact, Facebook has over 1 billion active users and Twitter has over 140 million users. Social media allows a person to express themselves, share their opinions, share stories, and even learn. Approximately 8 out of 10 healthcare companies are using social media sites in some way. This shows how large of a potential social media can have for health communication. So why not use it? Well, when jumping into the reasons for using social media for health communication, there's different advantages and disadvantages to consider. Now, do these advantages and disadvantages outweigh one another? That's up for debate. In regards to advantages, a certain article by Anne Moorhead and other authors defines 6 key benefits. These can range from different ways to provide public health, emotional and peer support, health policy advances, tailored information for a patient, more interaction, accessibility, and so many other things. Another advantage to health communication through social media can be to clear up misconceptions and confusion. That's such a way that physicians can do a one-to-many communication style. Now, in regards to disadvantages, the article also revealed 12 limitations to social media use in regards to health communication. This can involve negative health behaviors, quality concerns, accuracy concerns, confidentiality and privacy concerns. Maybe social media use could be a deterrent for patients to visit their doctors since the information is readily available to them. Platforms might be more effective than others, and not everybody is on certain platforms like Twitter and Facebook. Patients could even be unaware of their risk of exposing their private information online. And with that, people might even believe certain things on social media to be diagnoses. Certain diagnoses can be correlated with negative health behaviors because if the information isn't correct or a patient isn't following it correctly, there could be adverse consequences. Next, it is important to look at a patient's and the population's perception. Data shown from a survey of HINTS in 2007 showed that approximately 69% of U.S. adults report having access to the internet. This is a lot of people out of the entire population of the United States, and that was back in 2007. I'm sure that more than 69% of adults have access to the internet now that it's 2020. In regards to health communication, certain ages can use social media for different reasons. In regards to older adults, they might use online support groups or social media platforms to share their stories and gain advice in regards to specific diseases and their health status. Younger populations might not participate in these blogs or online support groups through social media, but they are more likely to have a larger presence on social media. Most social media is drawn to target younger populations, so that leaves a big potential for healthcare providers in giving information to younger populations as well. If physicians teach them better options and better things to do as a younger person, they are more likely to follow those healthy habits later on in their life. In regards to social media, there are a lot of expectations that patients seem to be having in regards to its potential use with health communication. The PwC Health Research Institute in 2012 completed a study that showed these expectations. 75% of people actually expect responses to their questions within 24 hours. Now, this could be reasonable or unreasonable depending on the question. It's important to realize that physicians are busy people and they might not be able to answer thousands of questions on social media within 24 hours. Another important point to make is that 61% of individuals feel that they would trust the information posted by their providers on social media. This would enhance accuracy. A provider can get status on social media that shows they're verified. Verification can show that they have accuracy in the information that they provide. And even 45% of individuals said that information on social media would most likely impact the decisions they make in regards to their health. Even in 2020, it was said that 79% of Americans have a social media profile. That is a large percent of people that can be reached by different physicians, professionals, and even other patients in which people can share their stories. The next thing to address is a physician's perception. Most often, physicians are most fearful and concerned with privacy and ethical issues. They want their patients' information to be protected and their own information to be protected. Physicians are required to follow HIPAA laws, which protect a patient's medical information and privacy in general. Physicians realize that sharing information can sometimes be uncomfortable for not only themselves, but their patients, so they have to be extremely careful with what they share. Physicians should only be providing answers to questions, help, and resources. They can't diagnose a patient online, and this is where some misconceptions can come in. Patients often end up selecting their providers and physicians based off of their presence on social media and ratings about them on social media. This is what really encourages physicians to have a bigger presence on social media itself. Physicians are really excited about the possibilities of social media, but physicians are often very busy. They're dealing with patients inside of their offices every day. As I talked about protecting privacy, it's something that's key to health communication, whether it be on social media sites or off of social media sites. Physicians are worried about protecting their patients' health information and privacy. Yet, it's actually found that consumers and patients don't object to their conversations being monitored on social media. With monitoring, it can help eliminate fears and privacy protection qualms that physicians are having. To successfully use social media in health communication, training and policies need to occur. Organizational policies can be put in place by certain companies in regards to protecting reputation, privacy, and productivity. And social media policies specifically can direct the healthcare workers back to the existing legal guidelines and ethical guidelines that they should be following when giving advice and education to patients all over social media. A really great example of a company that's using social media in health communication now is the Mayo Clinic. They can be searched on YouTube and different social media sites, and they give many educational videos and advice to patients. And it's a great example of how social media can be so impactful to a patient. When lastly reflecting on everything that's been provided here, do the benefits outweigh the risk, and will the perceptions of a patient and provider ever coincide with one another? This is hard to predict. Social media has a lot of potential, yet social media can be a vulnerable place in which patients and providers can make comments that can be misinterpreted. At what point can a patient decide if the information they're reading online is accurate? How do they know? Well, this can come with the verification that was talked about earlier, but not everyone can receive the verification. To really ensure privacy and accuracy, social media has to flourish more in the realm of health communication. More research and studies need to be conducted, as there's just not a lot of evidence in regards to the overall acceptance and productivity of social media in health communication. Social media use can only truly grow with the acceptance of both physicians and patients. Their perceptions need to slowly coincide with one another in what is expected. And with this, social media can truly benefit individuals in regards to their health and in regards to communication with their provider. That is all I have. Thank you very much.